Dr. Linstroth, Dr. Prayer, thank you so much for being available for this really important conversation. I want to talk about breast density. What is that?
Just as we are all different, our breasts are different as well. So every woman has a different amount of glandular tissue and fatty tissue in their breast. And when we're talking about dense breast tissue, those women have more glandular tissue in their breast. So the reason that matters is when we're looking at a mammogram, we have noticed that dense breast tissue, it's harder to see small cancers because dense breast tissue shows up white on a mammogram, and we're looking for white cancers on a white background, which can be much more difficult than women with fatty breast tissue, where we're looking for a white cancer on a black background. So it's important in that regard, and then also we know that women with dense breast tissue have an increased risk of breast cancer.
So what are the options then?
So we have two options here at Intermountain Medical Imaging for additional supplemental screening, is what we call it. So one of them is a abbreviated breast MRI, and that is similar to a full breast MRI but very shortened. So women only spend 6 minutes in the MRI scanner. So in that amount of time, we are detecting for small cancers that cannot be seen by mammogram. Another option we have is an automated whole breast ultrasound, and that's the machine that we are sitting next to here. That is an ultrasound that scans the entire breast and also looks for small cancers that can be hidden by that dense tissue on a mammogram.
Okay, and this, I have to say, is very comforting actually to see this, right? This is not an intimidating looking process to come in and have done. What can a woman expect if she does come in for this procedure?
So for this procedure, they would just be laying on an examination bed, and we use a kind of gel to put on the breast, and then they get this device is just gently placed onto their breast tissue, and then it scans in a couple different directions and takes an ultrasound image through the entire breast. So it's painless. It just takes a few minutes of scanning time, and in that time our ability to detect a breast cancer is at least doubled from what we see with just mammogram alone.
And you kind of hinted to this, but again, can you remind us who are great candidates for these types of screenings?
So these screenings, what we call supplemental screenings, and that's the automated breast ultrasound and the abbreviated breast MRI, are great options for women who have dense breast tissue, which is about half of women in the United States. So it's very common to have dense breast tissue. So we want women to be aware of their breast tissue density, their increased risk of breast cancer, and their options as far as additional screening.
Okay, so these are additional screenings, but where do these fit in your breast care, right? Can you do these in place of a mammogram?
Yeah, that's a great question. So we still recommend mammogram. Mammogram has benefits for certain things like precancerous changes can be detected really well on a mammogram that you may not see as well on a MRI and ultrasound. So these are supplemental screening where you would do a mammogram, for example, in January, and then you'd get your abbreviated breast MRI or your whole breast ultrasound 6 months later in July, and then you alternate those two screening tests. It's not one or the other, they're really complementary tests that work together to give us kind of a big picture.
Okay, so it's more about the full picture,
yeah.
Right? Okay. And let's talk about how important early detection is. We hear this all the time.
Sure, yeah, early detection, being able to catch your cancer when it's 8 millimeters, which is the size of a pea, versus something that you can feel that usually is about an inch or so in size, can help to decrease your stage so that your prognosis is better. Certainly leads to less treatments for a lot of women. Instead of necessarily needing chemotherapy, you may just need surgery. So definitely may have less treatment, prognosis is better. So we certainly advocate for doing the screening to catch things early.
Okay, and if women watching are interested in this additional screening, what's their first step?
So when you go in for your screening mammogram, the report will give you your breast density, and if it says you have dense or extremely dense breast tissue, and you would get a letter probably saying that you need to get supplemental screening, you can talk to your provider about ordering that additional imaging. You can call the number that it'll be on the screen here to request that additional screening, and the automated whole breast ultrasound and abbreviated breast MRI can be done at Intermountain Medical Imaging, so that's where your provider could order it for you.
Wonderful. Thank you both so much. Greatly appreciate this.
Thank you.